podcast is brought to you by the Association for Coaching, one of the world's leading international professional bodies, which is advancing coaching in business and society worldwide.
I'm one of your hosts, Christian van Nieuwerburgh, Professor of Coaching and Positive Psychology at the Center for Positive Health Sciences at RCSI, and I'm very interested in the integration of coaching and positive psychology.
And I'm Paula Nacif, Wellbeing Coach and Researcher and Senior Lecturer at the Masters of Positive Psychology and Coaching Psychology at the University of East London.
We are delighted to bring you this 7-part series exploring the similarities and differences between coaching for well-being and health coaching.
These terms are often used interchangeably, but this series suggests they represent very distinct practices.
We have lined up some incredible guests who share their insights, ideas, and experiences in health and well-being contexts.
We aim to provide answers and understanding on this fascinating and important area of coaching and many more questions.
Today, I'm joined by Dr. Pádraic Dunne from the Center for Positive Health Sciences at RCSI University of Medicine and Health Sciences. Pádraic has a background in immunology and psychotherapy. He is the program director of the Masters in Positive Health Coaching. Importantly, he's got the fantastic ability to make science relatable and understandable. I'm excited to hear his insights today. Pádraic, thank you so much for being on this podcast. Anna and I have been really looking forward to talking to you and getting your thoughts, particularly around how lifestyle medicine fits into our conversation about coaching for health and well-being.
Thanks very much, first of all, for the invitation, Christian and Anna. It's great to be talking to like-minded people, and there seem to be more and more like-minded people these days emerging, which is great. Lifestyle medicine, it's an interesting field. Usually when I'm talking to our scholars on our programs, I start off by saying that if your great-grandmother walked into the room while I'm teaching this, they would say, so what?
Yeah.
It's just common sense. There's nothing new. It's as old as medicine can be because it's common sense about eat some healthy food, get a little bit of exercise, make sure you look after a little bit of sleep and have some friends and family around. It's really just common sense. I suppose it emerged as a field probably maybe 25 years ago. I think it emerged really as a means to address prevention in medicine, and particularly prevention in relation to what are called non-communicable diseases. And I know we've just relatively recently come through a pandemic, but at the moment, the biggest killers globally, on average 41 million people a year, are dying premature deaths because of these non-communicable diseases. So you've got things like heart disease of all kinds, you've got type 2 diabetes. They're actually called the diseases of civilization. Obesity is a serious issue. Certain cancers, lung cancers, for example, related to tobacco, smoking. And then you have very serious mental health issues that lead to premature deaths as well. Originally, the founders had this in mind. But before lifestyle medicine actually emerged, there were other branches emerging that were trying to address the same thing. So it gets slightly confusing in medicine, I think, and outside, because you have things like functional medicine, which is also looking at prevention and going beyond medications. You've got integrative medicine, which takes spirituality into account as well. So you've got these confusing terms, and really lifestyle medicine is about really preventing non-communicable diseases and promoting health. That's essentially what it's about.
Thanks so much, Pádraic. And I'm so grateful that you and I are both together at the Center for Positive Health Sciences, where lifestyle medicine is a big component alongside coaching and positive psychology. So are you able just to share a little bit about how you see the intersection between those three things and any others that you think might be relevant?
Yeah. So again, this term positive health, it might be new to some listeners, but it's actually an old term as well. That emerged in the late 1920s in the UK. The term was actually used again to try and describe prevention rather than treatment and medicine. Prevention is an age-old idea, and positive health was actually used in the first definition of health with the WHO in 1948. So it's an old term, but when we talk about positive health in terms of the Centre for Positive Health Sciences at RCSI, again, when I have my scholars, I'll throw up a Venn diagram on the screen, and usually what I'll put up is positive psychology intersecting with lifestyle medicine and health psychology. And really, when we talk about health psychology, we're talking about elements of behavior change. What's the science behind sustained behavior? And then for me, the most perfect delivery system for those three elements is positive health coaching. So that's how we wrap it all together. But the caveat is that all three circles must have an evidence base for them to be positive health sciences. But positive health coaching, as I said, is a delivery system for us of those three things.
Oh, that's fascinating, Pádraic. And it's really interesting to learn that these terms have been around forever and a day, a little bit like well-being. I was thinking, as you were talking about your Venn diagram, and I'm thinking about the different ways of looking at well-being, like eudaimonic and hedonic well-being. So for our listeners, this is very old. It comes from ancient Greece and some of our philosophers, and thinking about different ways of looking after ourselves that's not really linked to health, potentially. So if I give you an example of one of my clients that came up in my research for well-being, and I did run well-being group coaching. One of the people in my empirical study, at the end of the whole program, when I was talking to him about what he took away from that program, he said, "I'm meeting my brother tomorrow." So just to give people a little bit of background, this person was estranged from his brother. He was here from another country here in the UK where I run the study. And throughout the whole program, we didn't talk about his brother necessarily, but there was a realization that what he needed for his well-being was this connection that was missing. And you did mention be around family and friends. But this to me has a very different feel to health psychology, which is behavioral. So I really want to perhaps your perspective on things which are less behavioral, perhaps, and that is within the domain of well-being, that helps people understand how they work and what they need, which might be outside just the behavioral aspect of it. Does that make sense in terms of the question I'm trying to ask you?
Yeah, I think so. And for lifestyle medicine, it's very hard to get out of the behavior because it does come from a medical model. So it is drenched in behavioral aspects, and it's drenched in biology and medicine as well. Just for your listeners, to describe the pillars of lifestyle medicine before I go into the connectedness, which I think is what we're really talking about. So you've got sleep, which is one pillar. You've got eating predominantly healthy food. You've got physical activity. Now, I'm not saying exercise, because exercise is scheduled physical activity. So physical activity can be walking up the stairs to go to work. Then you've got avoiding risky substances in general, and that can be anything from alcohol to illicit drugs, for example. Or it can be ultra-processed food, for example, is a highly risky substance, for example. Then you've got connectedness, which is a hugely important pillar, and managing stress. So there are the 6 pillars. And if we come back to connectedness, so in lifestyle medicine, there's kind of a horizontal and vertical connectedness. So the horizontal one is connection to your friends, family, and then the wider community, which is hugely important. And then we're talking about the vertical, which is spirituality. If you're religious, it's religion, it's meaning and purpose, that kind of vertical and horizontal connectedness. And even though these things are obviously linked to behavior, connectedness is a huge element in lifestyle medicine. And one of the reasons it's a huge element in lifestyle medicine is because of the data that emerged from the Harvard longevity study, which started, in 1938. I'm sure you're aware. Longest ongoing study in the world. All the researchers who started that, I'm sure they expected that the results would show that people who ate primarily plant-based food and ran 2 marathons a year and maintained a healthy weight and got 8 hours of sleep every night, that they were going to live the longest with the longest health spans. And okay, those things are good, they're important, but the 2 things that help people live the longest with the longest health span is connection to other humans and meaning and purpose. Now, those 2 things aren't really medical, are they? I mean, you're not going to walk into your average primary care center and start really talking about connectedness in that way. But that's what the longest medical study is showing us about health. So for me, those elements of well-being are hugely important as sleep, as important as eating your healthy leafy greens and everything else, but they're largely ignored. So that's why when you cross over positive psychology with lifestyle medicine, those things are lighting up, especially the connectedness areas. And I think that's where well-being then starts to intersect with health. Yeah, the behavior stuff is important. It's not the be-all and end-all. It can be useful for certain individuals. For others, it's really not. Something that I'm becoming more and more interested in now is actually awareness of self and my orientation in the world towards a greater good. But that's another story.
Thanks, Pádraic. And when you talk about awareness, what I'm getting from this is that the pillars of lifestyle medicine is one way of raising awareness for our clients of here are some things that you could practically engage with that will, according to research, enhance your well-being. So with that in mind, where can coaches or other positive psychology practitioners learn about lifestyle medicine?
Well, you can come on to our website at RCSI for the start. So RCSI, Centre for Positive Health Sciences. We have developed a selection of what we call one-pagers on the pillars of lifestyle medicine. What we do is all our scholars who are on our MSc in positive health coaching, for example, they would use those one-pagers as a starting point. And those pages have links and QR codes to deeper information that's all evidence-based. And there's a lot of information packed into each page. So that's one source you can get access to. I would always recommend the WHO, because I think the WHO is a very, very important organization, the World Health Organization. We have also close links to the American College of Lifestyle Medicine. And if anybody goes on their site, they have a lot of really useful info packs on all the different pillars. When we're talking to our scholars, again, it's really important, unless they are medical doctors or healthcare professionals, the first thing we're going to say to our training health coaches is, you're not there to diagnose anything. You're not there to treat anybody. That's not what we're talking about. And again, the positive health coaching and the way we use it, as you well know, as a colleague on the course, is in the context of predominantly non-directive. However, once we have an agreement with the client or the patient where we can say, okay, I see you brought up the topic of health, or, as Anna was talking about a previous client in the group context, talking about your brother and relationships and the importance of that towards health. Well, I can say to you, well, Christian, would you mind if I showed you a piece of information that has all the evidence-based approaches to sleep hygiene, for example? Could we have a conversation about that? And if you say yes, then can we co-design a strategy where you develop a sleep hygiene program? And maybe we can talk about the relationships with your brother, Anna's example, and how actually those things intersect. Because the beauty about lifestyle medicine is all these things, they're not isolated. We don't live in that kind of arbitrary world of pillars, that are isolated in silos. This is all one human being, and they all intersect. One of the beautiful things about lifestyle medicine for me is that a rising tide lifts all boats. So if you start improving sleep, chances are you'll be less grumpy in the morning with your kids, which means you're more likely to eat some healthy food at lunchtime, which means you're less likely to reach for the third glass of wine in the evening, which means you're more likely to get some sleep that night, and around that virtuous cycle can go again. So again, it's a little bit of direction if the client accepts that in the moment.
I know that this is something our listeners are going to be, ears are going to be perking up because of this thing about how facilitative are we. And so I really like the message that the stance is facilitative, but that positive health coaches can share information that may be relevant. And I love the word co-design. That really captures it for me. It's almost like there's two experts there, an expert in lifestyle medicine or an aspect of health, and also an expert in themselves, their context, and what they like and don't like. So I love that idea. Anna, hand over to you.
Thank you for that. And I can see your passion for the field as well, Pádraic, which is beautiful. The question I have in my mind is, as professionals, how do we negotiate different expectations? So I heard you say lifestyle medicine in a kind of medical model. So there is a need for those pillars to be attended to. And I'm also thinking sometimes, again, coming from my experience of working with people who live with a long-term health condition, where other people are telling them, oh, you've got to do this, you've got to look after yourself, you've got to take your medication. And I'm working on the well-being side and thinking, well, there are things that right now that might be more important to them than these markers that were given by their doctors and nurses and healthcare professionals. So how do we negotiate that ourselves, looking at our clients and thinking, what are the expectations here? I think sometimes the system wants us to go in a particular direction where there is a need for that, of course, to improve the health of the client or patient. And perhaps as a coach, you might see something else that could be the levers of change, but which are not part of the expectations within the system. Well, what do we do then?
Thanks, Anna. That's a very big question, and it's a really important one. We just finished a project, which is a local community research project with one of our PhD scholars, Kriya Laknan, where we were looking at a health coach embedded on digital systems that were engaging with clients through video and through text-based coaching and working in the community. And these coaches, and Kriya in this case, was acting as really a liaison between the GPs in primary healthcare in the community and local social supports. And these questions were coming up all the time because the GPs are saying, you need to adhere to your blood pressure medication, you need to lose 2 kilos, and you need to eat more cabbage. And that's the end of the 7-minute consultation, and I'll see you in 2 weeks. And of course, there is more to health than taking your blood pressure medicine on time and trying to lose 2 kilos, but nobody tells you how to lose 2 kilos. And then we live in the real world surrounded by having to pay a mortgage, bills, kids, jobs, all that kind of stuff, right? Absolutely. So for me, it all depends on what the client wants. If the client comes and says, look, the GP is really on my case about, remembering to take my medication and losing 2 kilos. Well, if that's where they want to start, that's where they start. That's how I would view it. And we would view it in general. But I think what will emerge, and I'm sure all your listeners will agree, that when that therapeutic alliance is made at the beginning and when the coach offers that listening ear, that's probably the first time in maybe decades for some people where they've actually truly had a human being genuinely listening to them. So I think when that happens, blood pressure medication adherence disappears temporarily, cabbage disappears temporarily, losing 2 kilos. Now it's just you and I. And what we found in this research was that people were reconnecting with their bodies for the first time, maybe ever, reconnecting with what health actually means. You see, we don't need more knowledge about health. I have a phone here and I can access all the world's knowledge on medicine right now if I want to. And if it was as easy as that, we'd all be healthy, right? But I think there's an element of connectedness in terms of connecting our mind, our social worlds, and our body together. And the first step on that is awareness. And I think most human beings, for whatever reason in the 21st century, we've lost touch with these things. And I think the older we get and the more stressed we get in these environments, the more out of touch we become. And that idea of where we're like giant heads walking around in tiny little bodies, it does seem like that's the way we behave. And when the body gives us a little bit of aggravation, we ask it to shut up and give it some paracetamol and get it to disappear again and move on. And we get irritated when it's in pain or it's in discomfort, but we're not connected to it. So just to go back to that coaching conversation, I think that therapeutic alliance, that opportunity to be heard, that opportunity to be empowered creates a space where awareness begins to bloom. And to go back to Carl Rogers and humanistic psychology and psychotherapy, once those conditions are met, the human automatically knows where the good things reside and in what movement and direction to take. And then I think naturally the person then comes to you and says, you know what, can we return to what this GP is asking me to do? Can we try and find some mechanism where I can remember to take these meds in the morning because I just keep forgetting? Or can we work out some mechanism where I can focus on losing 2 kilos as a long-term strategy? And then the health coach can bring up, okay, well, it's recommended that 150 minutes of moderate exercise per week can go a long way to helping lose weight with reduced calorie count. And all that kind of data and information can come in then. But for me, the first position is that ear that's welcoming, that's empowering, that's opening the space. And I'm sure that's nothing new to anybody listening to this or to you guys.
Well, Pádraic, thank you. Definitely music to my ears, and our listeners can tell how lucky I am to have a colleague like yourself, Pádraic. And it is beautiful to actually be with scholars when we're teaching the Masters in Positive Health Coaching to really reconnect to that fundamental purpose of what is the contribution of coaching. So thank you so much, Pádraic, for sharing that. And so if we do think about coaching, you've mentioned this research project, and without getting too much into the detail of the actual research side of it, can you just share a little bit about the interplay between the digital component, you mentioned there was a digital component to that, and the human component?
Yeah, when we're applying for funding and it's really difficult to do any research like this, and it's really difficult to get the funding, and it's really difficult to get good people to do it, and it takes years and years and years just to do even the tiniest of project. I see Anna's smiling there. I'm sure she knows what I'm talking about as well. It's really difficult. So a project like this emerges. We had an idea that not everybody has access to face-to-face coaching, for example, and definitely not health coaching. So could we stick it on digital platforms and make it more scalable so that if somebody was living remotely, that they could access a health coach, or people with chronic disease who just couldn't make it to visit somebody in their home or in their practice? Because we saw a good 20% of the people we recruited had a chronic disease diagnosis living in this community. We called it Connect 5 because it was connecting individuals within a 5-kilometer radius. That's what we wanted to do in a community setting. The first company that we got on board with, unfortunately, they went bust 2 years into the project. But what we realized relatively quickly was the technology, if it wasn't working perfectly, was a barrier to coaching. We were told consistently that people over a certain age would never use a phone to do coaching. That was false, just not true. Once people were provided with support, they were absolutely willing to use it. We did a needs assessment and asked the community whether they wanted it. They overwhelmingly said yes. But when the technology glitches, it's a problem and it's a barrier. So that's definitely one thing that came across from that project. But nevertheless, it still worked, which was interesting. Now, I don't know how deep you want to get into the results on this, but I come from a very quantitative background in terms of my training. So it took me a long time to come kicking and screaming into qualitative research. I just had that silly old medical model view of I need data, and that data has to be biometrics and hard data and stuff like that. And when we initially did this, the first 6 months, we weren't seeing any changes in our questionnaires, our well-being questionnaires. And we were all profoundly depressed because we thought, this is weird, because we know from the coaches that they're getting great feedback and people seem to be happy, but there's no dial moving in terms of health and well-being. And then we did the interviews with people after the first 6 months of the phase. And then we had statements coming out like life-changing, completely transformed my view of health. I don't go to the GP as much anymore. I've stopped this medication, stopped that medication. But what we were seeing, and this is a roundabout way of me saying, coming back to awareness again, what was clear was in the time frame we were looking at, it wasn't long enough to see a movement in those well-being dials, but there was a blooming of awareness in these individuals. Again, I believe because our coach was magnificent, regardless of the glitches of technology occasionally, provided that ear for people to be heard, and then provided empowerment in terms of what, and they all needed different things. And they all came from different backgrounds and different ages. So that's a long-winded way to say that this thing did work in the community. It enhanced awareness in the people who engaged in it. But researchers like me especially need to be more patient when we're looking at well-being measures, for example. Don't know if that answers your question, but
Yeah, wonderful. Thank you very much. And I think this is where we are, is making sure we're getting a balance of that hard data, which a lot of people still want to see.
yeah.
We want to see the dial moving, and where some of the most powerful things are difficult to measure like that. So those qualitative interviews are wonderful. And I see you've got a question brewing.
Oh, I could spend the whole day talking about the study and everything else. I think it's more of a comment, which I want to make and then link back to practice, is how we defining and measuring things. So I guess one of the issues, Pádraic, is what measurements are we using for well-being? Because defining well-being in itself is problematic. And when you're working within a system, a medical system or a quantitative system, then you get to what are the markers of well-being. And it's really interesting when you raise awareness amongst people that they might feel worse before they feel better, because now they have more awareness of their own health and well-being, and they think, perhaps I could do better. I'm not doing as well as I thought I was. So there's so many questions within that. And I think linking back to practice, potentially how people, coaches, positive psychology practitioners, positive health practitioners, how we then define what we do for ourselves in our scope of practice and what are the parameters of our work is a question that I always have in mind, because in the Venn diagram, we're all practicing slightly differently and using different tools and different ways of working. And I think when I look at it, and I think it's a beautiful landscape with so much to offer clients. So I wonder what your views are in that. How do we define what we do? What questions should we be asking ourselves? if we want to either continue working in this space, or for some people, they might just be thinking about stepping into that space.
So you mean, Anna, of bringing health into the coaching room, essentially. And this is one of the things that, and I think I spoke to Christian about this in the past as well, so I've got a psychotherapy background. So the question pops up all the time for me with scholars and colleagues and everybody, well, where's the line between coaching and psychotherapy? That's one question. Another question, where's the line between coaching and the health of an individual? There is no line because it's all me. So it's just about what the coach is comfortable with dealing with and what the coach is trained to deal with, right? And I think it's really hard for coaches because they're seeing a human being who is a mixture of everything in front of them. For me, I think, first of all, if we look at how we train our health coaching scholars, like I said, the first thing we say is your job is not to diagnose, it's not to treat. And some of them say, yeah, but I don't know enough about sleep, or I don't know enough about physical activity, or I'm not a dietitian, do I have to go off and learn everything about healthy food? And no, you don't. So once you have the basic coaching skills and you can listen to somebody with respect, which we're assuming everybody listening to this right now is already honing those skills and has been for some time. For me, the health aspect comes in with, if the client says, look, I have an issue with sleep, the first question a health coach should be asking is, okay, that's great. Tell me about that. Listen. And then the second thing they should say is, I really think you need to make an appointment to see your GP as soon as possible, because you need to rule out any underlying pathology here first. And it's the same with any counselor or psychotherapist. Always, always, always recommend GP engagement first. That doesn't mean that they disappear to the GP and you never see them again. They need to come back to you because the GP will ask them to do things. And it's the same with counseling and psychotherapy. So it's for the health coach not to be afraid of sleep and not to be afraid of exercise and not to be afraid of risky substances or stress management, but to say, look, okay, I'm not an expert in dietetics and nutrition, but I know what the basic guidelines are and I know where to access evidence-based information. So if you want that door opened, here it is, and I can put you through this door. I can also recommend that you talk to your GP, or maybe, and this is another thing that it's important for our health coaches, I can recommend, let's say, a local dietitian in the area, because something that we recommend our health coaches do is, especially if they live in a certain community, that they build a directory of all of the local healthcare supports around them, but not just healthcare, social supports, gyms, writing clubs, walk and talk clubs, everything. So they have a massive directory where they can refer out so the person can come back in again. So again, it's not to diagnose, not to treat, but know where the accurate resources are, know where the trustworthy resources are. Familiarize yourself with the basic one-pagers. As I said, you can get it from our website. You can get it from the American College, the British Society for Lifestyle Medicine, World Health Organization. And arm yourself with that evidence-based content and then ask the person if they'd be willing to have a chat about it. Because I think we shouldn't be afraid to talk about these things, but then we should be honest and say, look, this is when now you need to go and talk to that expert, but come back, because now we're going to develop and co-design a strategy where you can get the most of your engagement with that dietitian or sleep expert or whoever it is. Does that answer your question, Anna?
Yes, it does. And I'm thinking about this co-design. Christian has already mentioned it. And for some of our listeners, I wonder if it's worth talking a little bit about what this co-design is, because there is information being exchanged. I think some of the questions that we, signposting people to different services. So what are the key ingredients of a successful co-design?
The co-design, I think it's your kind of standard behavior change platform that we usually would start on. Well, first of all, we identify the goal, the short, medium, long-term goals. It's everything that coaching does very well anyway. And then it identifies what the short-term plan is and how to. So let's say, for example, it was sleep. Many people have this issue. I only sleep 5 hours a night, or I fall asleep immediately and I wake up between 2 and 4 and I can't get back to sleep. So now we sit down together. We look at the sleep hygiene guidelines between us. We identify a small-term goal, which might be managing the bedroom for this week. So what are the barriers to you actually falling asleep, or what are the barriers to you getting back to sleep when you wake up? Identifying what those barriers are. What are the facilitators? Okay, now let's co-design some kind of metric where we'll know whether our new strategy works or not, and we'll block it into 7 days. If you're using a digital check-in thing, we can check in. If we have that agreement between us, we can check in via text if we want. That's not appropriate for everybody. Or we'll just check in next week. And we co-design and reassess on a weekly basis. We get new information and we change our plan. And we get new information and we change our plan again. And we fall off the wagon and then we get back up. And it's that co-design process moving forward. But it's a partnership. And it's not, and everybody listening to this will understand that, but it can be hard for healthcare professionals sometimes because they get locked into a directive mode. I know what's best for you, Anna, and let me tell you what's best for you, and this is what you need to do, and this is what you should do, right? Obviously, we don't do that. That's why we use that co-design term and partnership the whole time.
I love the way you've described that, Pádraic, and the idea of co-design and a partnership, and that really characterizes the nature of these relationships. I just wanted to reflect in my own practice, if I may, Pádraic. You've just made me think of a real example of this, and I just want to share with listeners that, these things happen. And I'm just holding on to that idea of signposting for a moment, because the big messages I'm getting from here is non-prescriptive, that the role is to share information, but also to signpost. And importantly, that we really want to encourage our patient or client to take personal responsibility. So I was coaching an executive, and it was a work-related matter, and we were talking things through. And then the person said something like, well, I'm not eating very well. When I'm anxious, I don't eat. And so I've only been eating this little amount, etc. And as I was listening to them, I got that sense you talked about, Pádraic, of wait, is there something else going on here apart from I'm stressed about this particular thing that's happening? And that's when I made a referral. I said, look, I'm not sure what's going on here, but I wonder, have you been to the GP recently? And that turned out to be a very helpful intervention, because it turned out there was an underlying thing to do with eating. And in this example, I'm not a qualified health professional. I wouldn't have been able to advise them about that. So I just wanted to amplify this idea of one of our roles is really signposting and knowing when to do that. And like you said, Pádraic, that client came back to me, and we carried on the work trajectory, and it was the GP that was working through the health-related aspect of that. So, Pádraic, you started off by saying there's a lot of interest in this, and that's something that Anna and I have also picked up. Maybe it is due to the pandemic, maybe it's for other reasons. A lot of interest in health coaching at the moment. Where do you see this field of health coaching or positive health coaching going in the next 5-6 years?
There's a number of different ways it's going. Initially, it piqued my interest, I would say, before the pandemic, around 2017, 2018, when I saw private medical insurance in the US using the terms health coach. Now, as I said, I come from a psychotherapy background, before that, immunology background. And when I saw that and I saw what they were doing, it lit a light in my head that, health coaches actually could be a bridge between primary and tertiary care. So in other words, so doctors in a primary care center, family practice center with, let's say, physios and public health nurses and social workers and psychologists and counselors. But then in the tertiary care system as well, in hospitals, where the consultants are asking individuals, and then you don't see them for another 6 months, and they're asking the GP to care, and you don't see the GP. So who's the link between the GP, the consultant who sits in the hospital, the local reading club, the local leisure center, and the individual? And for me, it's that health coach can fulfill that. And again, not to be the expert, but to be the expert in empowerment and in listening, and provide that anchor point in the center for that individual that they can return to over and over again, reaching out. So I think there's an opportunity there. I think there's an opportunity now. It might not have been grasped and taken up yet, but it's beginning to. Definitely private healthcare in Ireland is hiring health coaches now, and they're doing it from a money basis, obviously, because they want prevention rather than treatment because it's cheaper, but it is emerging. And the other thing I think that we see from our scholars, as you know, Christian, that we get a lot of healthcare professionals who are coming into our courses. They're not necessarily going to go out and become full-time private health coaches. They're not going to leave nursing or physiotherapy or GP practice. But what they're doing is they're learning the skills. When they're going through and learning the skills in our courses, they kind of think, I do this anyway. So they're recognizing that they've always been coaches, but they just hadn't put a name on it. And I think what they're doing is they're organizing how they approach patients better. I think they have a more 360 view of their health. A lot of healthcare professionals coming through our courses would realize that maybe the 7 minutes isn't long enough. They know that anyway, but they have a better understanding. They have a more of a respect for health coaching, and they'll refer out to health coaching. So I think there's many different angles. Another thing that we see emerging, again, as you know, is the number of teachers who are coming in our courses. And again, they might not necessarily want to become private health coaches, but what they're doing is they're using the health coaching expertise to bring it into the classroom, or as school principals to bring it into the school as an ethos for understanding health and well-being, and again, learning how to listen properly, learning how to empower the individual. And then, of course, you have people who want to go into practice, So they're the three different things I think we're seeing at the moment.
So definitely exciting times, Pádraic. I'm excited by that vision and seeing how these opportunities seem to be right now happening all around us. And, this is the Association for Coaching series of podcasts. So the coaching community are bringing that curiosity about what can coaching provide to this arena of health and well-being. And positive psychology are embracing this. We're hosting the European Conference on Positive Psychology in Dublin in July of 2026. And its theme is positive health. So the positive psychology point of view are interested, and health and medicine. Our center is in a University of Medicine and Health Sciences. And in fact, RCSI is number one in the world for the United Nations Sustainable Development Goal number 3, health and well-being. So it seems to me, and this is becoming clearer to me having heard you speak, Pádraic, is that there seems to be appetite from all angles and an opening or a hope that when we bring these areas together, we can all achieve more. And we've been using that word prevention, Pádraic. And I think it's a good one to hang our hat on to say, okay, for me, it's more than prevention. For me, looking after somebody's well-being is an end in itself.
Mm-hmm.
But I do feel that word prevention is something we can all say, yeah, we actually all want prevention. And lifestyle medicine seems to play a really important part by bringing together evidence-based approaches to some of those things that lead to well-being. Anna?
It's a great segue for my question and reflection, really, is that prevention is so important. And yet we know that in terms of in the healthcare system, the money is not there for keep the firefighting. And prevention as a word is in every healthy strategy in Ireland, in England, in Wales, and so on, in Scotland and all the British Islands. And yet the money doesn't materialize in that. But that might not be a problem we can solve here between us and our practitioners. But one thing that I'm thinking about, you've mentioned teachers, you've mentioned nurses, doctors. What can we do as professionals to support a little bit more of this bringing well-being to people's everyday? Because if we think about it, we think about parents, children, communities. We are interacting with people on a regular basis. And perhaps we're coaching in different arenas, in different settings, doing different things. I'm completely biased, but I think well-being is so important for any type of coaching that we do. To me, is the key, is the heart of our interactions with people. So what can we be doing as practitioners in our day-to-day lives to just bring that to life a little bit more?
I think, Anna, for coaches in general, is to not be afraid of the health and well-being aspect of things. As you say, it's utterly impossible to extract health and well-being from us and just look purely at some one-dimensional element of us. It's impossible. So it's not to be afraid of it. Make sure as a coach that you're going towards the reputable sources, because what we have today is a tsunami of misinformation and disinformation of, let's be honest, grifters who are online and making lots and lots of money with various agendas. So the key is to find out where you can get that trustworthy evidence-based information. And people are more than willing to provide that information for free. I mean, there's so many fantastic universities across the world that just have this stuff for free, We, again, because that's where we're based, Christian and I, in RCSI, I mean, it's part of our remit to provide free sources for the public. So I think it's know where the sources are and familiarize yourself with them. Okay, if you want to get a little bit of training and education in it, that's fine too. Go and do that. I think that can't hurt. If you've got some money and you've got some time, just to add that other layer to your expertise. Again, you don't have to be an expert in dietitian and physical training, but just to have that little layer, that's no harm. But definitely go and read. And I think even if you don't have that additional qualification, lifestyle medicine or positive health sciences, just go on to the WHO websites and you'll see they have beautiful fact sheets. If a client says or presents with issues with sleep, I would just go onto it and just say, look, this is beautiful information here. You know you can trust the WHO, or you know you can trust the British government or whatever university, and just use that. Obviously with the proviso, please go and talk to your GP as well, because I know I'm kind of over-egging the pudding here, but there are so many conditions that hide for many years and manifest out as seemingly innocuous things like, I'm losing an hour of sleep here and there, or I'm losing a little bit of weight, or I'm gaining a little bit of weight. And to have another professional like a coach sit in front of you and say, you know what, like Christian said, maybe go and see your GP, but come back and let's have a chat about that then, So again, don't be afraid of going out and looking at the health and wellbeing literature. Know who the reputable sources are. Make friends with healthcare professionals. Get their advice. Get them to know what coaching is, because not enough healthcare professionals know what coaching is. And the more they do, the more likely they are to bring you into the fold, because most people want the patient in their context or the client in our context to do well. We're all in the same camp. So make friends with healthcare professionals. That's what I'd say.
Thank you so much, Pádraic. And thanks, Anna. What a great question. And what can we all do? And thanks, Pádraic, for sharing those ideas. And for me, as we bring our podcast, this beautiful conversation to a close, I just want to reflect that what we're all saying here, the three of us, and I know that's what our listeners are thinking, is really to bring health and well-being into every conversation. And I think, Pádraic, you referred to it as the therapeutic relationship. But I think part of it is showing that we care about our clients as human beings. And if we do care about them as people, then to demonstrate care for their health and well-being, I think that's really part of it. So I'm just really grateful to have had this opportunity to explore these ideas with you. Anna and I have come into this really curious and open and wanting to learn as much as possible. And Pádraic, you've provided us with so many thoughtful insights and reflections. I know our listeners will appreciate it too. Pádraic, thank you so much for joining us today.
Thank you.
Thank you. It's great fun. Thanks, Anna. Thanks, Christian.
Thank you for listening to another podcast by the Association for Coaching.
For over 20 years, our purpose has been to inspire and champion coaching excellence, advance the coaching profession, and make a sustainable difference to individuals, organizations, and society.
To find out more about the AC and our member benefits, follow us on LinkedIn or visit our webpage at associationforcoaching.com.
Explore our digital learning hub and enjoy our extensive library of on-demand webinars, interviews, podcasts, and a portfolio of live events for your continuing professional development.